Retiring. Congratulations. But you still got some time left on that employer plan, whether it be through COBRA or an extension by some severance package you got. Do I really need Medicare now? And I can always extend COBRA 18 months and maybe convince my employer to keep me going forever. We better stop right there, because if you don't listen to Medicare's rules, bad things can happen. I know it's hard. Retiring. So many changes. Why do I have to give up the medical plan that I've had for so long? Well, Medicare actually has rules and guidelines when it comes to retiring and medical. I'm not going to go through the group portion of it, but just know that if you are retired and you're not actively employed and you're over 65, by rules of the group plan and Medicare, Medicare becomes your primary insurance. So what that means is, for Parts A services, hospital, and B services, outpatient surgery, and outpatient visits and outpatient services, Medicare has to pay first. And if Medicare is not there, then the group plan, COBRA, retiree coverage, or what have you, does not need to actually pay for your services. And this is actually the legal rights of that group or COBRA plan. As you can see here, in the 1980s coordination rules as per Medicare, the group plan, if they can't find that wonderful Medicare coverage, you will not get coverage. Group health plan coverage is based on your status as a current active employee or the status of your spouse. Next, what does Medicare actually say about this? So on the Medicare website, if you look under retiree coverage, if you're retired and have Medicare and a group health plan, a retiree coverage from a former employer, generally Medicare pays first for your healthcare bills and your group plan coverage pays second. Okay, what's the big deal, right? I've had this group plan before. They've paid all of it before. The premium's not changing. Well, Medicare's rules state that, right? So why is that so? I believe it was created, or this rule was kind of put in place to alleviate some of the burden from the group health plans. Because you're already entitled to Medicare, why not use the program? And I believe that's why it's done that way. Now, I didn't write the rules, I'm just a messenger here, so don't shoot me. All right, well, so you got COBRA, and remember, COBRA is treated the same way as retiree coverage, as COBRA says, again, if you're over the age of 65 and you have Medicare, Medicare still is your primary insurance. So we run into that same problem that we did back with the retiree plan. Now with COBRA, there's a little asterisk. So you can keep COBRA for 18 months. And if you're a beneficiary of somebody or you're on someone's plan, let's say I'm younger than someone who's 65, but I'm on their plan for whatever reason, and then they get Medicare. I, as the member, beneficiary of their group plan, have 36 months. But if I had Medicare, that wouldn't be the case. Now also think, if you have COBRA, and you can get COBRA, you can get it after you turn 65, provided that Medicare started before you got onto COBRA. I know it sounds really confusing, but think about it this way. If you're over the age of 65, you have the option to get COBRA. But you still need to enroll in Medicare Parts A and B because that's still your primary insurance. If you're under the age of 65 and you get COBRA, when you are eligible for Medicare, you have to let COBRA know, and at that time, COBRA can drop you. So why would you even consider, or why am I even talking about keeping COBRA in certain circumstances if you're over 65? Well, Medicare has a Part D drug problem. And some medications might actually save you money if you stay on the COBRA plan as well. So by paying for that extra $500, $600, $700, $800 a month, that might actually save you money versus going with Part D with Medicare, because certain medications, and I'll go into this later, actually cost up to $16,000 a year, even with adequate Medicare Part D coverage. So we know why we need to enroll in Medicare. How do we and when do we enroll in Medicare Part B? Normally, if we weren't actively employed, we'd have to wait until what's called the general enrollment period. And that's from January 1st to March 31st. If you wait till that period though, when you sign up, your coverage will not start until the following July. So fortunately, that's not where most of us watching this are. Most of us watching this are probably still actively employed, and you'll be able to get this form, L564, filled out by your current or former employer. Now, this form asks to certify that you have coverage from the time you were at least 65 until now. And also they will ask when your last date of employment was, or if you're currently still actively employed, because what this does is it gives you what's called a special enrollment period. And the special enrollment period is for you to enroll in Part B, because if not, back to that general enrollment period where your coverage will start on July 1st and you might need it before then. And what happens then? Remember, beginning of the video, retiree insurance, COBRA, without Part B, you don't get any coverage anyway. So with this special enrollment period, we can get onto Part B when we have to. And you guys should get on the program of Part B as soon as your group coverage ends. So if your group coverage is set to end on, let's say, September 30th, then you want your Part B to begin on October 1st. And on your application for Part B, you can actually add in the remarks section, start my Part B October 1st, 2021. Now, if that's not the date you wanted to start, simply replace what I said with what you need. All right, so Part D with Medicare. Now, for Part D of Medicare, if you have COBRA or retiree insurance, typically you'll get a form from them saying that they are credible coverage when it comes to prescription drugs. And that's the Part D part. Now, where I really want us to look at, or at least you, to look at your current medications is if you have either RA, rheumatoid arthritis, hepatitis C, or are being currently treated for cancer. Because those medications can cost anywhere between $8,000 to $16,000 per year with Part D coverage. So I can do this analysis, and you can watch more videos on how to do this analysis, but you can actually plug into medicare.gov how much your medications are probably going to cost you depending on what you're taking now. With that said, if that number is extremely high, then most likely you're taking one of these expensive medications that aren't covered really well on Medicare. If that's the case, I would look at your COBRA or your retiree plan and see exactly how much you'd be paying for those medications on that plan. Because sometimes for COBRA especially, you can keep that plan for a little bit longer, and in turn, that'll help pay for some of those more expensive medications that you're on. And for those of you who are not yet with those terrible diseases, and I wish that on nobody, but if you wanted to plan for those instances where Part D won't cover you well, there's only a few choices. You just have to either, one, save money on the side. You can, like I do, I have cancer coverage, cancer insurance, to help if anything like that were to happen and I need really expensive medications. I personally have it though for the fact that if I have cancer, I probably can't work. But for many of my clients who are retired, I get it so that it covers their exposure to that $16,000 Part D problem. And you don't need it, but I do suggest you look into something by either buying the cancer coverage or earmarking some money to make sure you have something on the side just in case you are exposed or you have to pay those ridiculous Part D prescription drug costs. Well, there you have it. You need to enroll in Part B. You know how and you know by when you need to enroll in Part B. I'll see you in the next video where I discuss why I do believe that Medicare Parts A and B are probably the best medical insurance you're going to get, at least in America.